Imagine tripping on a sidewalk and suddenly feeling a sharp, intense pain shooting up from your ankle. Or maybe, it's a simple twist and a pop, and suddenly, something doesn't feel quite right. Bone fractures can happen to anyone, anywhere, and they're a lot more common than you might think. Whether it's from a high-impact accident, a small misstep, or even an underlying health condition, understanding bone fractures can make a world of difference in handling them confidently and recovering effectively. Section 1. What is a bone fracture? A bone fracture is simply a break in the bone structure. Now, bones are pretty resilient, they handle a lot of daily stress and strain. But under enough pressure, they can crack or break. It might sound scary, but most fractures will heal over time, with the right care and a little patience. Not all fractures are the same. Some breaks are clean and straightforward, while others are messy and complicated. Understanding the type of fracture you're dealing with is the first step in knowing what to expect in terms of treatment and recovery. Section 2. Types of bone fractures. Let's dive into some of the most common types of fractures. 1. Closed fracture. This is when the bone breaks but doesn't tear through the skin. It's painful and often causes swelling, but it stays contained. 2. Compound fracture. This one's more intense. The bone breaks through the skin, often causing additional damage to surrounding tissues. It's a more severe type of fracture because of the risk of infection. 3. Green stick fracture. Think of a young branch that bends and cracks but doesn't break entirely. This is what happens in a green stick fracture. It's common in kids because their bones are still flexible. 4. Stress fracture. Athletes, take note, these are caused by repetitive motions, like running. Stress fractures are tiny cracks that can turn into bigger problems if ignored. 5. Pathological fracture. These occur when an underlying condition, like osteoporosis, weakens the bone to the point that it breaks with minimal impact. Each of these fractures has different causes, risks, and treatments. And while these are just a few examples, knowing the type can give you a better idea of what's going on in your body. Section 3. Causes of bone fractures. Now, let's talk about why fractures happen. The obvious cause is physical trauma, car accidents, falls, sports injuries. But there are other factors too. Aging. As we age, our bones become weaker. You might have heard older people say they're brittle. This is because, over time, bones lose density, making them more prone to fractures. Health conditions like osteoporosis or bone cancer can make bones more fragile. These conditions weaken bones from the inside out, so they're more likely to break even with minor impacts. Repetitive stress, repeated motions, especially high-impact ones, put stress on the bones, leading to stress fractures. Athletes and people with physically demanding jobs should be particularly mindful of these. Section 4. Recognizing the symptoms. If you've broken a bone, it's not something you'll easily miss. Common symptoms include intense pain, swelling, and bruising. In some cases, you may even see the affected area at an odd angle. If it's a compound fracture, there might be bleeding where the bone has broken through the skin. Some less obvious symptoms to look out for include a grating sensation in the joint, difficulty moving or putting weight on the affected area, or even discoloration around the injury. Knowing these symptoms can help you identify a fracture early, which can make a huge difference in recovery time. Section 5. How are fractures diagnosed? So, what do you do if you suspect a fracture? Start by seeing a doctor, of course. They'll likely ask about how the injury happened, and from there, they'll move on to a physical exam. Most fractures can be diagnosed with an X-ray. In some cases, they might use a CT scan or an MRI to get a better look, especially for more complicated fractures. Section 6. Treatment and the healing process. Once the fracture is identified, the next step is getting the bone back in place. For simpler fractures, doctors might be able to do this externally, without surgery. This process is called reduction. For more complex fractures, surgery may be needed to align the bones properly. Doctors use several methods to keep the bone stable while it heals. Casts or braces, these are the most common. They restrict movement, allowing the bone to heal naturally. Metal plates and screws. These are used in cases where the bones need a little extra support. Intermedullary nails. These rods go inside the bone cavity to keep everything in place. External fixings. These are devices outside the body that stabilize the bones. Healing a fracture can take anywhere from a few weeks to a few months. Factors like age, overall health, and the type of fracture all play a role. But even after the bone itself heals, you may need physical therapy to regain full mobility and strength. Section 7. Complications in healing. Fractures usually heal well, but sometimes things don't go as planned. Here are a few potential complications. 1. Misalignment. If a fracture heals incorrectly, it can affect the bone's function and appearance. 2. Delayed or non-union. Sometimes, fractures take longer to heal or don't heal at all. In these cases, doctors may use treatments like ultrasound therapy, bone grafts, or even stem cell therapy to stimulate healing. 3. Bone infection. In compound fractures, bacteria can enter the bone, causing a serious infection. This may require antibiotics or even additional surgery. 4. Avascular necrosis. If blood flow is disrupted, the bone tissue can die. This condition is rare but serious. Understanding these risks can help you stay alert during your recovery process and catch potential issues early. Section 8. Preventing bone fractures. Preventing fractures is easier than you might think. Strong bones need 3 key ingredients: calcium, vitamin D, and regular exercise. Weight-bearing activities like walking, dancing, or even lifting weights are excellent for building bone density. As we age, bone health becomes even more important, especially for women after menopause, due to the natural drop in estrogen levels. This hormonal change can accelerate bone loss, making fractures more likely. A diet rich in calcium, sunlight for vitamin D, and regular exercise can go a long way in keeping your bones healthy. And remember, it's never too late to start. Conclusion. Fractures can be scary, but understanding them is the first step to overcoming them. Whether it's recognizing symptoms, knowing the types of fractures, or understanding treatment options, knowledge is power. With proper care, patience, and perhaps a bit of lifestyle adjustment, bone fractures can be a temporary setback, not a permanent limitation. Take care of your bones, and they'll take care of you. Remember, it's not just about avoiding fractures, but building a foundation of health that will support you for a lifetime.